The TGA, since the beginning of the rollout in February, has been publishing a weekly safety report. This is together with media releases about new serious adverse events. But our weekly safety report, which is now out on the website at www.tga.gov.au, does describe the current status regarding adverse event reports and adverse event cases. And I'll just outline some of the main features. I just want to go back a step and remind people that for every 1,000 doses of either the Pfizer or the AstraZeneca vaccine administered, we receive between 6 and 7 on average adverse event reports. Now, these are reports, they're not necessarily cause and effect from the vaccines, but these are people who have either felt unwell or have presented to a doctor or a hospital after being vaccinated. And overwhelmingly, these reports are of the sorts of things that are associated with any vaccination generally. Fever, joint pain, muscle soreness, tiredness, maybe even nausea and vomiting. And for the 2 COVID vaccines we have at the moment, these were expected and found in the clinical trials. The adverse events are more common after the first dose of AstraZeneca, but they're more common after the second dose of Pfizer globally, recognising that not many Australians have had a second dose of AstraZeneca. And that seems to be the pattern with the global. We also, of course, get reports of people who have had significant medical problems and at the same time, a week or 2 or 3 earlier, they've had 1 or 2 of the vaccines, either of the vaccines. And they're the cases that we look very closely at for investigation. I'll come back to those. So we've had a total of just over 15,000 adverse event reports, and that's a significant increase over the types and numbers of adverse event reports that we've had in previous years. But of course, in previous years, we haven't had a program of the nature of the COVID vaccine. And we know that these COVID vaccines do in a number of patients provide short-lived and not serious adverse events such as the tiredness, the fatigue, the sore arm, the sore muscles and so forth that I talked about. So so it doesn't mean that the COVID vaccines are less safe than other vaccines. The other thing that stimulated the reporting, of course, with vaccines being on the front page all the time, has also been deliberate raising of awareness among individuals and the general public. The requirement of healthcare professionals, whether they're GPs who are administering the vaccine or whether they're state and territory facilities, to report these adverse events to us. And so we've seen a very significant increase, and we're actually, it might sound funny, but we're actually encouraged by the fact because we want consumers to report adverse events directly to us, whether it's any vaccine or any medicine. And we've had a 60-fold increase in the number of adverse event reports made to us by consumers since compared with, say, 2020. And so over 3,200 of those adverse events have actually been reported to us by consumers. And again, we see that as a good thing. We want to encourage people to step forward. And of course, we undertake to look at all of them and to dig deeply into the serious and unexpected ones. There have been more adverse events reported in the last week. So we've had about 1,967 in the week, which is actually 26 April to 2 May. Now, there's a bit of a lag for the general adverse events, although we jump right in and analyse the serious ones as soon as we get the information. The lag period is obviously to allow us to complete the investigations, because often we have to go back to people, to their doctors, to their hospitals. Now, of that just under 2,000 adverse event reports, there have been more reported for AstraZeneca than Pfizer on about a 3-to-1, 2.5-to-1 ratio. But that actually reflects the relative levels of the 2 vaccines given in the community. And so on a per vaccination basis, we're seeing about the same number of adverse event reporting, whether you're having AstraZeneca or Pfizer. There's not one vaccine, but overall, for all sorts of adverse events, is giving a lot more signals or a lot more reports than the other one. Now I'll talk about what we call the adverse events of special interest, the serious ones. And so with Pfizer, globally, a very small but significant number of people have reported anaphylaxis, a severe allergic reaction. Now, in Australia, there were 55 cases reported to 24 April, but only 16 on investigation were genuine anaphylaxis. Now, all of those people have recovered. They were often treated with adrenaline by their healthcare facility. And there's a warning with the vaccines that if you've had this sort of reaction to similar sorts of products or vaccines before, don't get vaccinated with the Pfizer vaccine. And that, again, is consistent with the global estimated rate. Again, I'd still confirm that it's a comparatively rare event, with only 16 cases reported in Australia. I now want to come to AstraZeneca and blood clots, which I know has been the adverse event that's received most media and public and medical attention globally. So during the reporting period, we've received 163 reports of blood clot disorders for people who had had AstraZeneca vaccine a few days or a couple of weeks beforehand. And there were 44 reports received, in the week 19 to 25 April. We've had 163 overall since the rollout started. Now, that might sound like a large number of reports, but again, you'll remember that sadly, blood clotting, including fatal blood clotting, is actually quite a common cause of serious illness and death in Australia. We've talked about 50 cases a day being quite serious and this was before we even had COVID vaccines. It's also responsible for about 10% of the deaths of people who die when they're admitted to hospital and sadly never get out. So this is a common, serious thing that happens to people for a whole lot of reasons. But in each of those 163 cases, we've dug deeply into looking at cause and effect. And the other thing that distinguishes, of course, this very rare event with the AstraZeneca vaccine is that there's also low platelets and typically an antibody to a particular protein on the platelets. So there's a lot of tests that are run with these people. So I can report today that we have identified 5 cases since we last stood up last week. 5 new cases of clotting and low platelets that we believe are likely to be linked to the AstraZeneca vaccine. 5 cases. And they are in a 74-year-old man, a 51-year-old woman in Victoria, a 66-year-old man in Queensland, a 64-year-old woman from WA, and a 70-year-old man in Tasmania. And you'll notice that all of those people, one just, are over 50. But if you stop back and think about who is now getting the AstraZeneca vaccine, it is only, with a few rare exceptions, it is only people over 50. So it is obvious that future cases will be in the over 50s. And remember, the early results globally showed that the prevalence of this rare side effect was much more common in people under 50, but it wasn't unknown in people over 50. So we're not at all surprised with the results we're seeing. If you're only giving a medicine or a vaccine to people over 50, that's the only group you'll see an adverse event. So that takes the total number of cases to 11. And as of the 2nd of May, which was when the last lot of new cases were reported, we have a couple of possibles coming through, there was about 1.4 million doses. So you can do your mathematics for yourself. And I would say the rates in Australia are very similar to those both publicly and confidentially reported to us in places like Canada, the UK and continental Europe. There are 3 possible cases of this syndrome, but we don't think they're caused, but again, we're waiting on some more tests, but at the moment they're appearing to be negative, but they're still under investigation. Now, I want to share some really good news. That might sound funny in the middle of talking about adverse events to a vaccine, but I want to share some really good news with you today. And what it is, you'll remember last week we talked about 1 sad death and 5 hospitalisations to date. That was a figure as of about the Anzac Day long weekend that we'd reported on and we spoke about last week. And I don't want to talk about individual names and states, but I will give some aggregate results. Of those 5 people who were in hospital with the side effect, the really great news is that 4 of them have gone home. And of the younger ones who are of working age, 2 of the 4, a couple of the older are not working full time, but they're back at work. And so while they were in hospital and in some cases in intensive care for a day or 2, the really good news is that 4 of the 5 people have returned home, and the other person is doing quite well in hospital. So we're really excited with that news that only came through today. I would add for the death, I indicated a week ago that we're awaiting the findings of a post-mortem. Now, coroners do move at their own speed. They have hearings, they look at medical evidence, and then there's often an inquest. And so we don't have an update on any results from the post-mortem from a woman who sadly died. So just to finalise, the adverse event remains very rare. It remains at a frequency that's similar to that reported by other countries using the AstraZeneca vaccine. The evidence from TGA and the advice from ATAGI, the advisors to government, is that the benefits of this vaccine for the over 50s still very significantly exceed the risks of this vaccine. Remember that, and sadly we see that Australia is not immune from community transmission, and we're certainly not immune from cases coming in through hotel quarantine. And remember that the risk of serious illness or death dramatically increases by every 10 years of age once you turn 50. And by being vaccinated, we're not only protecting ourselves, but we're also protecting our loved ones, especially the older and more frail loved ones, and those around us in our community.